Welcome to Weighing Up Your Options with Dr. Stephen Watson. In this series, Dr. Watson discusses his background as a surgeon and some of the most common questions asked about weight loss surgery. Let's get started.
Thanks so much for speaking with us today, Steve. I just wanted to go through a few different questions that we have in regards to weight loss surgery and also about yourself. So first off, tell me a little bit about yourself and your background as a weight loss surgeon in Perth.
Yes, thank you for that question. I was born in the country and I studied medicine in Perth. And then in the 1990s, I went to London, and my plan was to do colorectal surgery. But I came back from London, and that was the beginning of weight loss surgery, and it was a really exciting time in Perth in the late 1990s. And I started doing gastric banding in 1999. I've seen lots of changes over the years since then, and a lot of very exciting changes. And I've now done about 10,000 of these weight loss operations, and I've seen some really fantastic results, which keeps me very much involved with the patients.
Great. So can you give the listeners just an understanding of weight loss surgery today and its role in our society today?
Weight loss surgery is becoming increasingly important in our society. Probably for the first time in history, if we continue down the pathway of obesity in our society, our children are actually going to die earlier from obesity. So it's become a really crucial part of what we need to do to help the individual and the family and the society. It's got to be remembered, though, that surgery is only a tool to losing weight. It's an important part of the jigsaw puzzle, but it must be remembered that it's not a standalone treatment for obesity. Obesity is a disease, and with any disease process, whether it's heart disease or kidney disease, there are other factors that come into play besides surgery, but surgery is an important part of the treatment of obesity.
Great, absolutely. As a patient, what are the most important things to consider when deciding on going ahead with weight loss surgery?
It's very important that this is a part of the process. It's very important that the patient's got to be prepared to work with the operation and the team as this operation is a tool. It's important for the patient to be part of that team. It's really important, too, for the patient not to be influenced by other members of the public or the family or work colleagues and take advice from others. It's important that there are risks to the surgery, and we need to minimize these risks. And finally, it's very important to realize that this is an ongoing process. This is not an operation that you're left by yourself. It's part of an ongoing process with the team involved in looking after the patient.
So I guess going on from that as well, if I was to come in for a consultation with yourself, what would happen during my first consultation?
During that first consultation, I want to find out what it is the patient wants to achieve. I want to find out from them what their goals and aspirations are, what has brought them to this situation where they're looking at surgery. And that can be a myriad of things. It can be heart disease, it can be infertility, it can be work-related issues. I need a bit of a background from the patient. That's to help me in the future to make sure we get the best tool to that patient. We discuss the options of surgery, and sometimes those options are not to operate if it's not appropriate. I show the patients a movie of the operation, and I outline the process of what's involved in moving on and how we can best help that person achieve their goals.
So when it comes to after the surgery, so how important is the post-operative recovery and the follow-up period with yourself?
The post-operative process after the operation is extremely important. Again, the surgery is a tool, and by itself, it's not going to achieve a long-term outcome. This is a journey that begins before the operation. There's the operation, and the journey continues after the operation. And that journey is in consultation with me and in consultation with the dietitian. The long-term role that I have is to ensure the patient has a good and safe outcome and adequate nutrition, and to deal with any problems that may come to light during that follow-up process. It's a journey. We're all in this together, and it's important that the patient feels that they're part of a team.
Thank you for tuning in. If you'd like more information about weight loss surgery, please visit us at lapsurgery.com.au. We'll see you next time.